further ado, it is my pleasure to introduce one of my favorite people in the whole world. Well, everyone on the panel.
I was just, you say that to everyone, Christopher.
The publisher of The Blade, Lynn Brown.
Well, thank you, and that's my elevator speech. So good evening, thank you for coming. And my name is Lynn Brown. I publish the Washington Blade newspaper weekly, America's gay news source. Thank you so much. I don't do it alone. The Blade is a staff of 12 now and very dedicated, committed people. I'm exceptionally lucky to enjoy the job I have. I also enjoy my job this evening as moderator of this esteemed panel. I'd like these three women to introduce themselves, and we'll proceed with a little, after the intros we have a tiny structure. Our goal this evening is to discuss, or our larger goal this evening is to figure out in the next 45 minutes how to improve women's health care. No small feat, but here we go. Our first panelist, Chiquetta.
My name is Chiquetta Brooks. I am the Director of Client Services at Mottner Project, the National Lesbian Health Organization. We are located in DuPont Circle, and we serve women in the community and the LGBT community at large, educating people on cancer care, and larger women's and LGBT health issues.
I'm Barbara Lewis. I'm a physician assistant here at Whitman-Walker, and I might take just a little longer just to introduce myself because I feel like some of the history is important about maybe what some of this panel is about, and some of the things that Denise and I have been talking about women's space and sort of the cyclical nature of communities and how they come and go. So I basically started actually at the Washington Free Clinic here in Washington, D.C. back in the early 70s as an early feminist, interested in women's health. And at the Washington Free Clinic, we started a Women's Health Night. I mean, we painted a big red women's symbol on the wall of the Georgetown Lutheran Church with a fist and a speculum in the hand. And that was one of our earliest symbols. And I'd like to say that the Gay Men's VD Clinic, which started on Saturday morning for men, actually modeled themselves on the Women's Health Night, which was not a lesbian health night, but it was a feminist women's health night. And then the men said, oh, we want to do it too. So they started it. And it's actually, that's what actually where Whitman-Walker came from, was the early days of the Washington Free Clinic. So we were a women's health collective, and we did women's health. And when Whitman-Walker started, they were looking for a women's group or a lesbian group to become part of Whitman-Walker, since it was going to be a gay and lesbian health group at the time. And we were like, okay, so what does that mean, lesbian health versus women's health? And so it was starting in those late years in the 70s, late 70s, when we started to try to figure out what a lesbian health agenda is versus just a women's health agenda. And we can talk a little bit more about that later. So I actually went to PA school, became a physician assistant, and we started as the first lesbian health clinic in 1979 when Whitman-Walker had its first building at 17th and Q. And this was all before HIV was in existence. So we did do a lesbian health night. Now, over the years, and it'll kind of segue into your things, the AIDS epidemic hit. This became a huge AIDS service organization. And the little lesbian health clinic kind of went by the wayside a little bit. But then the program for lesbian services got funded in 1990. And it became a program that started doing more than just a little clinic, but it also did support groups and information and a lot of things around lesbian health. The thing that changed is we started again another women's health night here at the clinic, in which we had a women-only space, and women were really interested in having a women-only space to come in for their health care, as well as the space to come in for support groups. But over time, we morphed into the concept of community health clinic. And one of the things that I would say about that is that in those days, women did want to come in a women-only space to get their health care. But if given the choice over time, whether or not you had a little vaginal infection and you had to wait till Monday night, or you could call and knew you had a lesbian-friendly or women-friendly, not even lesbian-friendly, provider on Tuesday afternoon in a mixed environment, what would be your choice? And actually what we found out is that women wanted to come like it was a regular doctor's office or have the convenience of coming anytime but to a place that they knew was still affirming, even if it was sort of mixed and had a very diverse crowd. And so I think the idea of having a women-only space on a Monday night kind of went the way of us how we are now. Whitman-Walker used to have separate clinics for everything, and now it's like a regular doctor's office. I work here as a PA, and I may have somebody with HIV, and I may have somebody for trans care, and I may have a lesbian who wants a pap smear, and somebody who just wants their high blood pressure checked, because now we do primary care. So I think the concept of community health clinic, which Megan was a big part of, and the idea that we do a whole group, offer diverse services in a total try to be friendly environment and culturally competent environment, and is what our goal here is now. So I'll stop there.
So around 95 is when I got involved. I'm Denise Bump, and I'm here as a community activist tonight. I ran the women's bookstore, 99 to 2001, I think. I'm actually very, very strong and a big advocate for the things that Whitman-Walker actually does for women. I've stayed involved with Whitman-Walker because when I came to the DC environment, it was a little overwhelming in the 90s to be an out lesbian. And Whitman-Walker had rap groups and many services just for women, and actually counselors that you could talk to. And that's where I met most of my community until I got involved with the Llama's bookstore. And the space that we've had for women in the past, which was LSP, was a unique space that was just for women. And as you've already pointed out, we've evolved from that. But we still do serve here at Whitman-Walker. I've been a volunteer for the rap groups for a number of years. And the women who come to the support groups include women starting over who are just out of a long-term relationship and need support. There's a coming out group for women. Newly diagnosed HIV, I'm not sure that that's women and men separated, but there's a number of support groups that the women do attend here, and that's primarily what I'll talk about. Is that I'm also involved with David Mariner came in with the DC Center and trying to work with the men, which is really fun. I'll just say that because David's in the room, to find out how women can become more involved in not only the Whitman-Walker programs that they offer here. Obviously the attendance tonight is okay, but there's a lot of women out there. So getting the women involved and getting the women to talk about health is very difficult and very hard initiative to start. So I'm anxious to hear what we all come up with or we talk about tonight.
Are there any